what makes life a misery is not the really serious disease. It's the rather unbearable but trivial phenomenon which doesn't really necessarily respond very well to over-medication with very powerful substances. There's a lot to be said for gentle, progressive medication which works by way of putting the organism back into balance with itself. In lots of cases that I've seen, people who've been rather knocked about by over-medication, by heavy allopathic medicines, return with some relief to their old medicines. The only trouble is that they can't confess that they've been using them to their practitioner, who is often extremely contemptuous.
Many people have a misconception as to what a herbalist, a medical herbalist or herbal practitioner really is and what he does. They seem to think that herbalists are just people who have a dirty little shop, usually round in a back street somewhere, with a stuffed crocodile hanging from the ceiling and a bubbling cauldron in the corner, the sort of person who would mutter strange incantations and magic spells and potions and tell you to take something under a full moon. Nothing's further from the truth in these days. In this practice, there are 3 qualified herbal practitioners in partnership in exactly the same way as a group practice operates under the National Health Service.
Yes, and we look forward to seeing you at 10:30 on Wednesday morning. Thank you. Goodbye.
The herbal practitioner of this country who is qualified, who takes careful examinations under the National Institute of Medical Herbalists after 4 years of full-time training, is a very well qualified and highly trained professional person.
Now, will you just repeat 111 for me, please?
111.
Thank you.
They know what to prescribe and what not to prescribe, and the public can consult any such person with absolute trust and the safeguard of knowing that they are properly qualified
Now, will you please
to help them.
take a deep breath through your open mouth and out.
Hello, Mrs. Waterfield.
Good morning.
Nice to meet you again. Do come and have a seat, will you? There we are. Well, now, it's about a fortnight, I think, since I saw you last time, isn't it? How are you getting on with those pains across the chest? No therapy has all the answers, whether it be orthodox or alternative. Well, I'd like to check your blood pressure, so could you slip up the left sleeve for me? Thank you so much. Now, herbal treatment tends to work best in chronic conditions. Things such as arthritis, rheumatism, skin diseases like eczema or psoriasis. But we also see, in an ordinary day's practice, a whole range of the type of conditions and illnesses that any ordinary person would go to their doctor with.
The figure is quite a bit lower than last time. That's called the diastolic pressure, which shows that your arteries are more relaxed, so
Well, we shall make up some more medicine. When we've arrived at the most accurate diagnosis we can, we then discuss with you all those factors which may have caused the problem to arise, because we're always careful to try and see what is the root cause of the problem and to decide how all the various factors in your particular lifestyle may have affected you and brought on the illness or disease that you have. The treatment that I would prescribe would consist of herbs, plants, roots, barks, berries, in tincture or fluid extract form or as tablets. And these substances are safe when compared with modern drugs. They have extremely rarely any side effects at all, and when prescribed accurately and properly, are totally safe. They are non-addictive and effective.
It's obvious that plants have tremendous power, and obvious that if you're going to be at all adjusted to your environment, if you're going to find out how rich it is, then you're going to have to start investigating what that power is. Once you get in amongst a community that lives with plants, that is aware of them as we're aware of people, then you start learning the real herbal lore. You begin to understand something about the magic of them, I suppose. I mean, magic's just a name for a power that we don't fully understand.
Rubbing a sliced garlic clove on the soles of a patient's foot suffering from a chest infection seems rather a medieval prescription. And this is exactly what it is. long, long ago, it was discovered that the oil of the garlic was a strongly antibacterial substance. It had the effect of clearing up a chest infection. And this is one of the strange things of herbal medicine, that very often one part of the body was treated, as it were, when another part of the body was sick, in ailment. And this is a typical example of something which, on the outside, rather like pounding earthworms with boiled oil, seems to be nonsensical. But it's deeply entrenched in scientific reality. For a start, the garlic oil is powerful as an antibacterial agent. Secondly, the soles of the foot absorb the oil more readily than any other part of the body. And thirdly, as we all know, garlic oil is passed out of the body through the lungs to greater effect than any other part of the body. We exhale it. So if you have a chest infection, rubbing the oil on the soles of the foot, oil goes into the body, into the bloodstream, is passed out, and at the site where it's necessary to effect a cure, you get your cure. Scientific reason, old wives' tale, hand in hand. The information that was gathered by our predecessors was largely kept together as the family law, and the data for curing was carried by the women. The mothers, the grandmothers, would run the home and would carry out the daily repairs on the men and the children. But very soon, groups of women became the wise women of a given area. They had a certain skill, if you like, in the healing process. And it was these women who were the early practitioners of healing, the early herbalists. Very early on, there was a divergence between those who used their skills for good and those who used their skills for evil. So we had the emergence of the witchcraft syndrome, as well as the herbalist syndrome. And this is a dichotomy, a branching, if you like, that is repeated time and time again through the history of man's use of plant material. It happens even today. Certain parts of the world, such as darkest Africa, there are both good witch doctors and bad witch doctors, those who will use plants to kill and those who are devoted only to the healing process.
With the development of different societies based on different ideologies, using perhaps religion, magic and mysticism as part of their development and know-how, so they began to introduce this into the use of plants, with the result that there became some confusion, a mix-up, so to speak, of the use of plants on a sound, rational basis, which had been practiced family to family to family, and then the introduction of new uses of plants based upon a magic or mystical system. And both these types, both these uses of plants have become intermingled in the same literature.
What is so fascinating about these herbals, and what is so central to the whole story of herbalism, is that in these books was not only truth, real observation, but also mystery, magic, folklore, and utter nonsense.
You see, there have been hundreds and thousands of years of the rational use of medicinal plants. We have also recorded irrational uses of medicinal plants.
Right, so how do we sort it out?
Well, over the last 50 years, there have been tremendous developments in analytical procedures, in clinical analyses, and what is required now is a modern scientific assessment of the therapeutic value of all these plants. Consider this plant, for example, the motherwort, Leonoris cardiacus. It has been used for hundreds of years and is still used today for women who have just given birth to a child, whose heart is a little bit weak, who feel a little depressed, and this is a wonderful cardiotonic for women in this state. It really is a very valuable herb.
It's very unusual for a male peasant to tell you what to take if you've got something wrong with you. But it comes as second nature to his wife or his aunt or his daughter to say, da noi si prende questo. What we do is we take this plant here and we do this and this and this with it. The panacea for all kinds of illnesses deriving from overexcitement or nervous exhaustion is chamomile. It's the common thing that everybody uses for menstrual disorders, for premenstrual tension and so forth, and for cramps as well. And I think none of this is the result of instinct or arcane information. It's really because they've lived so close to the land, and sometimes they've been so hungry, they've tried to eat everything. Ironically, the poorer such people grow, the more balanced the diet they sometimes have. I noticed in India, for example, that the very poorest people, the agricultural labourers who worked for a bag of rice a day and sometimes didn't get that, because their children were eating uncooked berries and vegetables and green leaves, they very often had a better blood picture and skin condition and hair even than the children of the richer farmers, richer comparatively, they're still pretty poor by our standards, who were socially above them.
3/4 of the world population still depends on herbal materials, and in fact this is the only health care available to them. Most of the herbalists in the third world have been using some of these plant materials for many centuries. The World Health Organization has now recognized the importance of herbal medicine for the third world, and much research is now being done for their efficacy and for their safety, and indeed for standardization of some of these materials for use in the third world. The training of our modern pharmacists still relies quite heavily on pharmacognosy, that is the art of recognizing plant material, not only their chemical constituents by doing various chemical tests, but under the microscope to find out which part of the plant the tissues have come from, but most important of all, to see that there is no adulteration, and then chemically to find out what active ingredients are in these particular plants. And by having this knowledge, we are able to use the various parts of the plant for our modern medicines. So as an overall, his training and his knowledge of the pharmacognostical plant is a very important aspect of modern medicine.
Have you got anything? Nothing at all. They've not come out through. No.
Plant material is an important source of our modern medicine, and indeed in many cases it may well be the only material available for producing some of our modern medicine. The active ingredients are now isolated to form our major modern drugs.
What do you feel about this
I'm not
question?
opposed to the use of the constituents which can be isolated and purified if they have interesting pharmacological effects.
But you feel that the whole plant has a different action?
The whole plant must have a different or a modified action because it contains lots of other things, lots of other chemicals which are still there and which have been left behind.
It's surprising how much plant material is used in orthodox medicine. But the difference between herbal medicine and orthodox treatment is that the herbalist will always prescribe a medicine made from plant material in its natural, unchanged form.
Here in our dispensary, we have some 350 tinctures and fluid extracts, which are processed from herbs, roots, barks, berries, flowers, stems, leaves, and so forth, from all over the world. One thing that should be stressed is that every single substance that we use in the prescriptions here are natural. That is, they are produced from the herb as it grows and from the whole plant. We don't use isolated substances or any chemicals or man-made substances whatsoever. It is important to differentiate between the herbal practitioner and an ordinary herbalist. The herbalist is a person who owns a shop, who sells herbs, pre-packed goods, for self-treatment at home. And that herbalist, whilst they may know a lot about herbs, is not trained medically in any way. And self-treatment, it should be pointed out, can be unsatisfactory and unreliable.
In a shop like this, where a herbal remedy section is available to our customers, we encourage them to come and ask us for advice. Obviously, we're not qualified to diagnose any serious illness, but where in doubt, we advise our customers to seek professional medical advice, either from naturopathic clinics or a homeopathy clinic in the area. We can, however, offer remedies for minor ailments, coughs and colds, skin conditions, sleeplessness, stomach disorders, nerves and arthritic complaints. Sometimes natural remedies may not act as quickly as chemical drugs, but on the whole, people find them more beneficial because there are no side effects.
There is no doubt that for chronic illnesses, herbal medicine does have a role to play. This is basically because our modern medicine has very little to offer in this field. But for acute illnesses, we really need modern technology and sophisticated medications.
Things just ran, saw it this morning, but the doctor hadn't found time to change it.
I think we must also appreciate that modern medicine has high technology in diagnosing patients' ailments and doing various tests with modern machinery, like the X-ray machinery, with gamma cameras, and also doing various blood analytical techniques, whilst the herbalist hasn't got any of these at his fingertips. And there is a problem in diagnosing.
It's all kind of eased off now.
Good. Well, we can go further. Now, this blood pressure is very good indeed.
Great.
You'll be pleased to know. That's a big improvement, in fact.
On the other hand, the herbalist does have a major advantage over the modern medicine. It isn't his medicines which have an important role to play, it is the herbalist himself.
I feel that about only 20% of my practice is concerned with herbal medicine, which may sound surprising coming from a medical herbalist, but in fact, I deal holistically with a patient. It was the sort of advice the ancient Greeks gave us more than 2,000 years ago when they said the cure of the part should not be attempted without treatment of the whole. So I try to look at my patient as a whole person and take all factors into consideration. I try to point out to my patients that the chronic diseases they bring me have taken years and years to build up in the system. So part of my job is, if you like, trying to re-educate the patient. As you can imagine, all this re-education takes quite a long time. So an initial consultation takes at least an hour. And during that time, I try to get a really good psychological picture of the patient. I ask them questions about their background, about their parents, even about their grandparents, if they can remember them, about their hobbies and interests and the state of all the relationships that they're involved in their lives. I point out that their illness is the result of a whole complex of factors. It may simply be prolonged stress, for example. That's a very important factor. It may be the result of lack of exercise, because I'm afraid we've all become very sedentary, by which I don't mean I want people over 35 to get out and jog in the park and have an immediate heart attack. I want people to take slow, continuous exercise so they have a commitment to some form of exercise every day. And one of the most important factors in disease, of course, is diet. Poor diet, as the result of too much salt and sugar and fat and stimulants like tea and coffee, to which I'm afraid we're all addicted, can result in all sorts of chronic illness.
Now, in a herbal practice such as mine in Leicester, we take great care that every prescription is prescribed for that one patient and for that person alone. And so through all the 70 years that we've been in practice, I can truthfully tell you that no two prescriptions have ever been identical. Now, when we compare this with orthodox medicine, it is prevalent for a ready-made drug to be prescribed for a condition. Indeed, many patients may be given the same drug for a whole range of different conditions.
We hear so much nowadays about the horrific side effects that many modern drugs have, and I think people are quite right to be worried about it. But on the other hand, it's essential to keep a well-balanced view of this.
Side effects are important, and when drugs are prescribed, they are considered, but one has to weigh these up for the usage of these in a particular ailment, particularly for acute illnesses. And overall, the side effects are really not that harmful, bearing in mind the benefits that the treatment brings to the patient.
I really like using herbs for the chronic diseases, for things that require the long, slow uphill pull, if you like, gentle corrective treatment. But I would be the first one to rush into hospital if I had a severe accident or if I had a heart attack.
60 years ago, it would be common to find a prescription with 8 or 10 different herbal materials. But now, we've actually isolated the active ingredients. And these active ingredients are formulated into either tablets or injections to give a specific therapeutic effect. They can actually predict the pharmacological action, which was a very, very difficult factor with the use of various herbal materials, even though they did have the potent substances which the modern medicines have today. This is the difference between modern medicine and herbalistic medicines. Modern medicine is accurate and dose predicted, while the herbal medicine is still a hit and miss situation.
Herbal practice is a free choice. It is up to the patient to decide what type of treatment they desire. The British Medical Association does permit doctors to refer patients to non-registered practitioners, provided the doctor retains care and management of the case. In any case, if a patient comes to me, as very many do, and they are on drugs already from their GP, we would not take that patient off their drugs. So there is nothing to be afraid of. What we would be careful to do is to prescribe safe herbal remedies that can be taken together with the drugs, and then in due time, with proper monitoring of the case, we would hope to be able to reduce the drugs very, very gradually in most cases. There are, of course, some drugs which should not be reduced only under proper medical supervision. And it is essential, therefore, that no one suddenly decides to turn over a new leaf and simply throws all their drugs down the toilet without seeking a qualified opinion first.
As an overall, I think whether it's herbal system of medicine or whether it's the allopathic, the Western system of medicine, overall we are looking for safety and efficacy for the patient.
I really don't believe that there are any miracle cures, whether it be in herbal medicine or orthodox medicine. I think healing requires commitment from the patient, and I'm very interested in engendering this sense in the patient of them as partner in their own health care. I am not interested in playing God and handing out advice to them and saying, I will cure them. They are responsible for their own health care, and it is they who, with my advice, are going to heal themselves. So if you like, I play the role of a friend and a guide and an ally in their whole path towards getting better. And herbal medicine, because it's so gentle and so corrective and so quiet and slow, will work surely and effectively for a permanently beneficial effect.